Hello friends, the question is how is psoriasis diagnosed? First of all, let me tell you that psoriasis is a chronic lifelong disease. It's a chronic inflammatory disease. So in psoriasis, you must know the diagnosis why it is difficult. First thing, in psoriasis we notice that there is increased number of production of skin cells. How much more? Normally our cells that we see the body, this is the dead layer of the skin. Underneath that layer there is a living cells. Underneath there are number of layers in between, and when the cell is born at the basal layer, it gradually goes up and up and up. As it goes up, next layer, the circulation is less and it dries up and it falls off. Normally the whole skin that we see, it is completely replaced in 28 days. That you get a new skin in 28 days. For example, if you notice in snakes, they shed their skin, the snake skin, but they shed it at one time. So we know that complete skin is shed. We don't shed our skin at one time. We shed our skin daily. So daily some cells of the skin, they shed off and fall off. We don't notice while taking bath. Lot of cells go away. And in 28 days, a new completely skin comes up. But whenever there is a wound or there is a gap in skin, any injury, so it should take at least 28 days to fill up the gap. But normally it is not so. Any surgery you do or any big wound, it heals or it is covered in 3 days, because our body has a mechanism that is called as a wound healing mechanism that is inborn in every person. So whenever there is a wound on your body, so what happens at particular type, that whenever there is a wound, so there is a bleeding, and because of the death of cells, there are certain chemicals called as cytokines, they are secreted. And these cytokines chemicals, when the immunity knows it, it knows that there is an emergency and it needs to reproduce the cell faster. So body reproduces the cells 10 to 15 times more at the site of the wound, so that the wound is covered with the cells within 2 to 3 days. But the next thing is that when the wound is healed, the immunity, that is increased number of cells that is caused by immunity, goes back to normal after 28 days cycle. That is, every 28 days one new cell comes up. So that after some time you notice that the area that is of wound and the surrounding area, that mixes and you don't know there was a wound after some time. So this is what a wound healing mechanism. So I will explain you, if this wound healing mechanism starts but does not stop. So what will happen at the site of wound, since there is increased production of number cells, so you will get layers after layers, scales and scabs, and you will peel it off. So the faster the growth of cells will shed in the form of scales. What happens in psoriasis? This property of a body or immunity to increase the production of cells for healing of the wound is deranged, and irrespective of there are no wounds, it gets triggered, it starts. That is called as autoimmune. So normal function which should be there at particular time when needed, so it is triggered continuously and it doesn't stop. That is what psoriasis is. So in psoriasis patient we find that there is increased number of cells of skin, there are more cells are produced. So usually psoriasis begins in the scalp. So that cells, that dead cells is called as a dandruff. So they fall away. But it is not limited to the scalp. Gradually as the disease progresses, it goes surrounding the skin other than the scalp. For example, behind the ear, on the forehead, on the elbows, on knees or other parts of the body, there are similar type of wounds or lesions. They each, and there are formation of dead scales and again the new dead scales, and that wound is not healing. So this is what the psoriasis is. So if you know all this journey of a psoriasis from dandruff on the body, so that is a diagnostic evidences or diagnostic events where a clinician can diagnose the psoriasis like that. So one must know that psoriasis can be diagnosed clinically by observing taking the history of the patients, all these things. Another thing we find in psoriasis patient, there is usually a history of psoriasis in their parents, or almost 70% of the people, or almost if there is 100% of the people having genetic tendency of psoriasis, only 30% of them get and 70% do not get it. Although they have genetic tendency, they are skipped. Because psoriasis disease, although it is genetic, only genetics are not sufficient for psoriasis to precipitate. For example, a person is born with psoriasis, but he may not get the psoriasis immediately. Somebody may get the psoriasis at the age of 18, somebody at 20, somebody at 25, somebody at 35, somebody at 40. Why these changes in each individual? Because it needs the trigger factors. And if these trigger factors come in a life of a patient, then the psoriasis comes on the skin or it is precipitated. So these trigger factors are very essential, and they are usually the stress, tension, psychological tensions or emotional setbacks, failures or insecurities in life, love failures, breakups, or maybe the diet or excessive alcohol, excessive smoking, obesity, lack of sleep, lack of exercise. So many things are there in your lifestyle that tends to trigger the psoriasis that you have tendency. But if you avoid all these triggers, or if you know beforehand these are the triggers of psoriasis, you can delay or avoid psoriasis. So psoriasis is diagnosed like that by taking the proper history of the patient. But many a times it can also happen that psoriasis, when comes on the body, it is not a single commonest type. For example, the commonest type of psoriasis, which is in 80% of the patient, is a plaque type of psoriasis that we usually see and we know that that is a psoriasis. But psoriasis has number of different types. They appear differently. Their symptoms are different, their signs are different. So one must know the rare types of psoriasis also, like the gutted psoriasis, which comes in small pink colored spots usually after infection with streptococcal throat infection, malaria or typhoid. Or there can be another psoriasis that is in flexural part, that is in your armpits, groins, under the breast. So this is called as an inverse psoriasis. Psoriasis can be erythrodermic. Sometimes immediately the skin is red and very severe form of redness and scaling count, that is erythrodermic psoriasis. Or there can be a pustular psoriasis. So where there is immediately yellowish and whitish blisters on the body which are sterile. There is no infection, there is no bacteria or virus in it, but it is a sterile first. This is a type of psoriasis. So psoriasis has a different types also. It can cause pitting in the nails and hardness of the nails, yellowness of the nails, loss of nails. So all these are types of psoriasis. And not only that, in almost 50% of the patients who have psoriasis, they land up after some years in a type of arthritis called as psoriatic arthritis, where there is a swelling of joints. And this swelling afterwards causes fusing of the joints, and that is called as a psoriatic arthritis. Deformities do occur because of psoriatic arthritis. So psoriasis diagnosis is in different phases. So the commonest type is diagnosed easily, but there are number of types, and that needs a special doctor, that needs a person who is a specialist and who has seen lot of thousands of cases of psoriasis. He is the person who can diagnose the psoriasis, all types of psoriasis, in his clinic or clinical examinations. But there are sometimes that there are psoriasis comes is very common to other diseases. It can look like eczema, it can look like fungal infection, it can look like lichen planus. So there, for the doctor, it's very difficult. Even the experts, it's difficult. Then there is a test called as a biopsy. So skin part is taken, there is examined under the microscope, which clears that whether there is a psoriasis, there is a lichen planus, or whether it is eczema. So that is also the last final test, but usually psoriasis is diagnosed clinically. So this way it can be diagnosed. One final thing I must tell you, that according to allopathic science, there is no cure for psoriasis. Once it begins, it will never go in lifetime. Mind it well, I am talking it about allopathy, not homeopathy. Because many times people understand when I say that there is no treatment for psoriasis in allopathy, they understand that I am speaking about homeopathy. No. According to modern science, allopathy, there is no cure. Once there is psoriasis, it will be lifetime. And whenever it is in acute phase or aggravating phase, they will give the medicine, they will control it for some time, but it is bound to appear again and again. And whenever it comes back, it will come in more and more severe forms. And it will need more and more aggressive treatment. And sometimes the medicines that are given to control the severe psoriasis, they are so strong, or they can cause the side effects and just damage your vital organs, livers and kidneys. And after long use of that, one has to stop them because your body cannot tolerate it, your liver cannot tolerate it. Then you are left out with the psoriasis and its suffering. So what is about homeopathy? Homeopathy does have a cure for it, provided you come at a proper time before your immunity is not damaged, so that we can help you out. So with homeopathy, we do not treat the external results of psoriasis. What you see with your eyes is the results of psoriasis. The real cause of psoriasis is the defect in immunity that is triggered, and that is the increased reproduction of increased number of cells because of a defect in immunity. Homeopathy treats the defect in immunity, so that when the defect in immunity is treated, your immunity or your body produces the cells every 28 days. That is the normal speed. And then you don't need any other medications. And there are cases in Psoriatreat we have treated homeopathically. They do not have relapse almost 10 to 15 years, even when they have discontinued our treatment also. That is a landmark in the history of medicine, that we have given the results. So which is really entirely unknown or different to the modern allopathic science, according to them. So their homeopathy does have a cure, does have a long-lasting cure or long-lasting result and treatment for the psoriasis. So this way you can diagnose the psoriasis. And if you want a real more information on that, you can go to our website, where there are different types of photographs of different types of psoriasis, and we have also cured them. So you will be assured that these type of psoriasis can also be cured by homeopathy without any side effects. So definitely this way you can diagnose the psoriasis. Thank you.